Good evening, I'm Ian Hannamansing. Tonight, more records broken and Omicron is just getting started.
The specter of a surge is on our doorsteps.
New restrictions, the race to get boosters before the holidays, and
it's pretty dire.
The uncertainty for business owners and workers at a crucial time of year. Also tonight, Chief Political Correspondent Rosemary Barton and the Prime Minister in a year-end interview.
Omicron doesn't care if we're tired of restrictions.
From Omicron to Quebec's Bill 21 and that trip to Typhoon.
It didn't cross your mind that that might be a bad idea?
Here's McDavid in front, and Seaver scores!
Plus, the NHL tries to stop the surge of cases sweeping through the league. This is The National. On this Sunday night, less than a week before Christmas, the scramble across the country isn't just for last-minute shopping, it's for last-minute changes in plans as experts issue familiar pandemic warnings.
When we see how numbers are exploding right now, we probably need to impose more restrictions, I'm sorry to say.
The threat that Omicron can pose to all of us is really something not to be ignored.
We should be buckling up because we're going to have a pretty turbulent December and January.
The country hasn't seen anything quite like this. When the WHO declared Omicron a variant of concern, Canada had an average of 2,800 COVID cases a day, mostly Delta. Just 23 days later, Omicron is taking over, and that rate has more than doubled. Let's compare it to a similar point in previous waves. It's surging faster than the one in the spring, the wave that hit hard this fall, and the wave rising ahead of the last holiday season. And a reminder, that total doesn't reflect provinces which don't post numbers on the weekend. Rafi Boudjikanian looks at the officials, experts, and everyday Canadians as they face fast-changing rules and some hard choices.
Many at this Ottawa Christmas market are already scaling back expectations.
We were supposed to have a get-together with my research lab, but it got cancelled basically almost last minute.
Now we're thinking we might just do like presents outside and then go back home.
I was going to go to Turks and Caicos, but with COVID and everything going around so quick, we just cancelled it last minute.
Ottawa's case numbers are mirroring Ontario's, jumping to heights not seen since this spring. As new restrictions on indoor gatherings came into effect, Ontario announced more than 4,000 new cases, fast approaching record levels while other provinces break them. Nova Scotia posted 476 new cases, Quebec 3,846. And yet, at Trudeau International Airport, some holiday travelers pressed on. Boosters are thought to bolster protection against Omicron, but Quebec is only opening them up to those 65 and over starting Monday. They'll be available to all adults in Saskatchewan, where free rapid tests are in high demand.
I'd like to be able to test myself before seeing family members over the holidays.
But access to rapid tests is uneven, and according to experts, they won't be enough.
Pick a small number of people, be around them, be content, be close to home, wear masks, really concentrate on outside activity if you can. If you're inside, go with ventilation, up your mask game.
We have very limited capacity in the country now, so we have to be very careful. It's the transmissibility of this that is very worrisome.
In Vancouver, people have been lining up for the more accurate PCR tests. BC will impose new restrictions on Monday. For the first time, Omicron has now been detected in the Northwest Territories. While case counts rise in nearly every part of the country, Newfoundland and Labrador put in restrictions on new travelers.
The specter of a surge is on our doorsteps, and we need to address it now before we suffer the same fate.
Starting Tuesday, everyone entering that province will have to self-isolate for 5 days and take a rapid test each day, even if you're triple vaccinated. Rafi Boudjikanian, CBC News, Ottawa.
Well, let's talk a little bit more about the number of positive cases, particularly in Ontario. Dr. Zain Chagla is an infectious disease doctor. He's in Mississauga. And Dr. Chagla, just over 4,000 new COVID cases confirmed in Ontario. But you feel the actual number is much higher.
Yeah, from just being on the ground, it's taking a long time for people to book tests. The assessment centers are filled. Tests that are being done today were people that were booked 3 to 4 to 5 days ago. And so recognizing that a lot of people, aren't even able to access these tests, knowing people that have been diagnosed only based on rapid tests alone and their families are positive. It's likely we're seeing something like 15, 20,000 cases instead of this 4,000. And I think unfortunately, case counts are not going to be accurate for the foreseeable future.
And you'd like the testing to be more strategically directed?
Look, we have therapeutic options that can target patients at the highest risk of hospitalization, breakthroughs and not breakthroughs, and people that have been unvaccinated. I think we have to identify people who are high risk, people who work in high risk settings, and let them have priority access to testing. And unfortunately, people who are at low risk may need to just stay at home and ride out their symptoms in isolation as compared to getting a confirmatory test.
All right, Dr. Chagla, stand by. You and Dr. Alex Wong will be here later in the program to answer some more questions.
Thanks.
Faced with these mounting cases, many provinces have brought back capacity limits to try to slow the spread. And that is hitting some businesses and some workers hard. And as Talia Ricci explains, there are more calls for more supports to see them through.
A lively drag performance and tables stacked with brunch food would have been the scene at Glad Day Bookshop in Toronto. But surging COVID-19 cases changed that.
This weekend alone, we've lost $10,000 in event revenue that we would have had. So it's pretty dire, and it's a lot of money to lose right away.
Michael Erickson said he made the decision to protect the communities they serve. He says it feels a lot like March 2020, with one big difference.
I'm not sure why the governments haven't jumped and put supports in the way they did before.
Ottawa has created some new pandemic relief programs. Some are for businesses that can prove they've lost revenue due to public health restrictions. Others can help businesses and workers, but only in a lockdown or stay-at-home scenario, which isn't exactly what's happening now. But businesses say canceling events and reducing capacity is still resulting in huge losses, including some job cuts.
We are in a situation where we can't wait for a lockdown. How are they going to survive the holiday break with no jobs?
Workers who lose their jobs entirely can still apply for EI. But those still on the payroll need more supports too, say advocates, including additional paid sick days and better access to rapid tests.
So this is a mess.
The overwhelming thing with people that are currently in is not the fear of the virus. It's the fact that they have to lose shifts because of increased restrictions.
Erickson has taken it upon himself to launch a fundraiser, raising money for his shop and others in the community.
And I don't want to lay everyone off on the holidays.
But businesses are increasingly worried these restrictions could make that a reality if more help doesn't arrive soon. Talia Ricci, CBC News, Toronto.
Professional sports is also taking a big hit, with more players testing positive for the virus and more games being canceled. Today, the NHL announced it's postponing all of its cross-border games. And as Chris O'Neill-Yates explains, no one is certain where the season goes from here.
Now at center, Brock Besser shoots, he scores!
The NHL is taking drastic steps to keep the season alive as COVID sweeps through the league. Just hours before the puck was supposed to drop last night, the NHL pulled the plug on a sold-out game between the Vancouver Canucks and the Toronto Maple Leafs, as players on both teams entered the COVID protocol list.
Safety comes first, the safety of the players.
I think you're naive if you think it's going to avoid a team of 50.
It's in the other way, looking for the equalizer.
Today, the league canceled all cross-border games through Thursday. At this point, a total of about 40 games have been postponed.
Shooting on, scores!
COVID has forced a stoppage of play for 7 entire teams, including, as of tonight, the Maple Leafs. With the Olympics coming up in February, none of this bodes well for NHL players making it to Beijing.
I think it's over, and I think the announcement could come pretty soon. But, I think once they had to postpone the amount of games they had to postpone officially through today, it became impossible for it to happen.
Health and safety of everyone comes first, and in that department...
Omicron isn't just walloping hockey. NBA games have been postponed as well. The league and the Players Association are said to be in talks about tightening testing protocols. The NFL is stepping up COVID protocols too and rescheduling some games as more players test positive.
Young
Healthy people that have been fully vaccinated are getting Omicron. And that's just a heads up to all of us.
With the pace of spread, it could be a while before leagues get back to normal. And that timeline could apply to the rest of us too, says this expert.
It will be a pretty short, sharp peak with Omicron, the way the projections are right now. But I don't think we're going to be over it until February at the earliest.
Chris O'Neill-Yates, CBC News, Vancouver.
While sports leagues try to manage the spread on both sides of the border, U.S. health experts are warning Americans to brace for an Omicron tsunami this winter.
There's no doubt about this. This is extraordinary capability of spreading. We are going to see breakthrough infections, Chuck. There's no doubt about that.
Dr. Fauci is not the only one sounding the alarm.
All of the other previous variants pale by comparison in terms of the rate at which this one is spreading.
Today, two prominent Democratic senators revealed they have caught COVID, Elizabeth Warren and Cory Booker. Now recorded in at least 43 states, Omicron is prompting new safety protocols on everything from restaurants to live entertainment. Even Saturday Night Live dramatically changed course last minute after canceling the audience. A small group of cast members and celebrity guests put on a pared-back show.
So we thought we'd read these dumb jokes anyway and just see if we can make these guys laugh.
Yeah, you guys ready?
Yeah. Officials say Omicron will become the dominant strain there in a matter of weeks. And the new variant continues to drive sky-high infection rates in the UK. Government officials have signaled more restrictions could be coming, but throughout Europe, new limits just before Christmas are being met with protests. Here's Farah Marawi.
These lines outside the largest stadium in the UK aren't for a soccer match, but rather for booster shots.
As soon as I heard that they have an event here wherein they are giving the boosters out, so I decided to book one immediately for myself.
The UK government continues to push boosters as the best way to fight the surge. Today, more than 82,000 new COVID-19 cases were reported. At least 12,000 were Omicron. Many of the new cases in London. The city's situation now so serious, calls are growing louder for tougher measures.
If we don't bring in new restrictions sooner rather than later, you're going to see even more positive cases and potentially public services like the NHS on the verge of collapse, if not collapsing.
Other countries aren't waiting. Germany followed France's lead by banning non-essential travel from the UK. And the Netherlands went into a nationwide lockdown, with schools and all non-essential services closed until well into January. In neighboring Belgium, violence at a rally against that country's restrictions. Back in London, demonstrators clashed with police outside 10 Downing Street. But the opposition to COVID-19 restrictions isn't just on the streets.
The noes to the left, 126.
Nearly all MPs from Prime Minister Boris Johnson's own party voted against implementing vaccine certificates for some venues. And after resigning from cabinet this weekend, Chief Brexit negotiator Robert Frost urged against more COVID measures. For now, the UK Health Secretary isn't ruling out the possibility of further restrictions.
There are no guarantees in this pandemic. I don't think at this point we just have to keep everything under review.
What lies ahead in the days before Christmas is a balancing act, protecting the healthcare system without inflaming deep political divisions. Farah Morali, CBC News, London.
Back here at home, COVID was the political story of 2021. In a year-end interview with our chief political correspondent, Rosemary Barton, Prime Minister Justin Trudeau spoke about some of the challenges that lie ahead and his biggest pandemic concern right now.
The chance of the spread of the Omicron variant so troubling that this end-of-year interview done at a mass vaccination clinic had to be done fully masked and physically distanced. For the Prime Minister, in his third mandate and entering the third year of battling the pandemic, he is all too aware of the fatigue of Canadians.
My biggest concern is our healthcare workers. I know all Canadians are frustrated right now. All Canadians don't want to be facing this and just want it to be gone and want to have a regular Christmas.
The focus now on getting Canadians boosted as fast as possible to give them the ultimate protection, and the likelihood that 3 doses will become what is needed to be considered fully vaccinated and get on planes and trains in this country.
I think it's probably headed that way, but let's allow time for people to get vaccinated, but yes, get that booster.
As much as the pandemic has taken over Justin Trudeau's agenda yet again, he is also grappling with how that is affecting the rising cost of living for so many Canadians. His critics say he should be doing more to deal with inflation, something he admits could last longer than expected.
We're preparing for both outcomes. I know people are looking at, some people are saying, yes, it is transitory. Others are saying, no, it's more structural, it'll be long term.
After a Quebec teacher wearing a hijab was removed from the classroom under the provincial law that bans the wearing of religious symbols for some public service jobs, Trudeau says he may eventually get involved in the legal battle, but others should speak up too.
The challenge we have on this one is making sure that people understand that fundamental rights need to be defended. And yes, governments can and should defend them and have a role in it, but our fellow citizens can also be standing up for each other.
And the Prime Minister again expressed regret for one of his most prominent mistakes of the year, the decision to take a trip to Tofino on the first National Day of Truth and Reconciliation.
But on something that matters so much to you, that it didn't cross your mind that might be a bad idea?
We had a number of engagements with Indigenous peoples. We were moving forward. It was a mistake. It was an oversight, and it's one that I'm continuing to move forward.
Moving forward, Trudeau says the key to the end of this pandemic is getting people vaccinated around the world, which would perhaps allow the Prime Minister to return to what is on his agenda too. Rosemary Barton, CBC News, Ottawa.
And we'll have more of Rosie's conversation with the Prime Minister just ahead, including why he says inconsistent provincial rollouts of things like rapid tests and restrictions may not be a bad thing. That's in about 10 minutes. The Prime Minister was among those fighting a proposed U.S. tax credit for electric vehicles that many say would hurt Canadian car makers. Tonight, it appears to be dead, as a key U.S. senator has turned his back on Joe Biden's Build Back Better legislation. Katie Simpson with how that's playing out on both sides of the border.
Joining us now, Democratic Senator Joe Manchin.
Good to be with you, Brett.
Senator Joe Manchin is known for being at odds with members of his own party, and he used an interview on Fox News to cement that reputation.
If I can't go home and explain it to the people of West Virginia, I can't vote for it. And I cannot vote to continue with this piece of legislation. I just can't.
Without Manchin's support, there are not enough votes to pass President Joe Biden's at least $1.5 trillion Build Back Better bill, which includes universal preschool, a plan to lower drug prices, more than $500 billion for clean energy, and a tax credit for the purchase of U.S.-made electric vehicles.
I would have hoped that we could have had at least 50 Democrats on board who have the guts to stand up for working families.
The White House is furious. The press secretary said in a statement, Manchin's comments represent a sudden and inexplicable reversal in his position, and we will continue to press him to see if he will reverse his position yet again. In Canada, a very different reaction.
Right now, Canadian interests are well served by what the senator has said he would do. Let's wait and see if he sticks to that.
Ottawa is opposed to the electric vehicle tax credit since it would entice auto producers to choose the U.S. over Canada for new investment, meaning lost Canadian jobs. Ministers have lobbied American lawmakers, pleading with them to change or scrap that section of the bill. While these developments help, auto industry leaders say Canada can't relax yet.
We're on DEFCON 1 for Canadian prosperity, and we've gone back and forth over the last few weeks. I think we should continue to do the same thing.
The EV tax credit is the biggest irritant in the Canada-U.S. relationship. Ottawa will now watch to see whether the White House can get Senator Manchin back on board or whether it draws up a new, smaller legislation package. Katie Simpson, CBC News, Washington.
With the holidays fast approaching, tough conversations are on the table.
I'm not vaccinated. Wow. Why not?
Coming up, expert advice on tackling those difficult topics. And our doctors are here again tonight to answer your COVID questions. Plus, lawyers who helped Canada remain stuck in Afghanistan in fear for their lives.
It is really heart-wrenching to see that still we haven't heard anything from the government of Canada.
And a kiss cam at a sports game is a bit of light-hearted fun, but for one couple, it was really meaningful.
I looked at Jen, I said, Jen, we're on the Jumbotron.
We're back. after the break. Typhoon Rai slammed the Philippines, killing at least 200 people and causing extensive devastation. The storm hit with winds of 195 kilometers an hour, creating floods and landslides. It is the most powerful storm to hit the country this year. Ballots are being counted tonight in Hong Kong's election, but there won't be many to process. Less than 30% of the 4.5 million people eligible turned out to vote. This is the first election under strengthened powers for Beijing, including the power to vet all candidates. Critics say that weakens democracy. When Afghanistan fell to the Taliban back in August, some key Canadian allies were left behind. Lawyers who represented the Canadian embassy in Kabul are still stranded, and they're beginning to lose hope. And as Ellen Morrow explains, the message from their firm's owner, who did make it to Canada, is that Ottawa isn't doing nearly enough.
Sayek Sajan is trying to save his employees, acting where he says the Canadian government isn't.
There are people who did all what they could to help the government of Canada, to help and support the mission of Canada in Afghanistan.
Sajan's law firm represented Canada in Kabul for 8 years. This is his contract with the now shuttered Canadian embassy, still valid until the end of 2021. Sajan was able to get out, but most of his employees are still stuck in Kabul, fearful for their safety under Taliban rule.
I need to make sure that these people are out as soon as possible.
They've applied to Ottawa's immigration program for Afghans who supported Canada's mission. Sajan has even submitted letters from 2 global affairs officials on his employees' behalf, one writing, "I have personal knowledge of threats made against him and his firm." But months later, there's still no meaningful response from immigration officials.
I don't think if there is anybody that I could write to and I've not written to, anybody that I could call, I've not called.
These Toronto lawyers are working on their cases, which they say are mired in a bureaucratic backlog.
These are people who were working for us and I think have a sense of being abandoned.
We thought with the skills that we had, we'd be able to make a pretty immediate impact, but certainly as Canadians didn't expect to be met with the level of frustration and red tape that we have been thus far.
Ottawa wouldn't comment on this specific case, but defended its response to the crisis, saying it's working as quickly as it can to bring Afghans to Canada. Sajan isn't convinced.
It is really heart-wrenching to see that still we haven't heard anything from the government of Canada. And I really need the government of Canada to pay attention to this.
He says if people who worked for the Canadian government for years can't get a prompt answer, Ottawa simply isn't doing enough. Ellen Morrow, CBC News, Toronto.
After the break, the Prime Minister's year-end interview overtaken by a fast-moving variant.
Omicron doesn't care if we're tired of restrictions.
How he plans to tackle year 3 of the pandemic.
The principle of making sure that people can get on planes and trains and feel safe, we're going to need boosters.
Rosie's conversation with Trudeau is next.
Right.
We're starting to have a normal life back, and here we go again.
With Omicron surging across the country.
You need some rapid tests?
Thank you so much.
The race is now on to find rapid tests.
If people want to gather, they're going to want to test.
And get 3rd vaccine doses.
You got to protect yourself.
All while fighting not just the virus, but COVID fatigue too.
People were really looking forward to not having to think about COVID. The reality is we have to think about COVID.
Vaccines and rapid tests are just a couple of the pandemic issues the Prime Minister has been dealing with. Add international travel, healthcare funding, and that question we all have, when will this end? He addressed it all in his year-end interview with our chief political correspondent, Rosemary Barton. And here is some of their conversation.
I want to start obviously with the pandemic and Omicron and the fact that there is widespread community transmission in this province, in Ontario and some other places. And scientists in the UK now say that the reproduction number of Omicron is between 3 and 5. What is your biggest concern right now?
Well, my biggest concern is our healthcare workers. You know, I know all Canadians are frustrated right now. All Canadians don't want to be facing this and just want it to be gone and want to have a regular Christmas. But who's even more exhausted than Canadians are our frontline health workers, the people giving vaccines, the people caring for people in critical care units. They've gone flat out for 2 years, and now they're facing a winter that could be much, much worse because of Omicron. And all of us, we know this now. We can impact what the winter is going to look like if we hunker down, if we stay safe, if we get the booster shots, if we keep our distances, if we change our plans a bit to be a little more careful over the next 2 weeks. It'll make a huge difference for our frontline health workers.
But did you think that we would end up in this place where we are seeing thousands and thousands of cases a day in some parts of the country?
Well, I think every step of the way we've seen that the unexpected is happening. This is why we're prepared for it to a certain extent. I mean, first of all, Canada's secured millions and millions of booster shots into the next few years exactly for these opportunities. We're securing rapid tests, and Canadians now know a lot more about how to keep themselves safe, how to keep their communities safe. We're tired of having to do it, but we also know, because we've proven it, we can go through these waves and get back to normality a bit more and then have to tighten up. It's something we're all learning how to do.
Sure, but I think what's different this time, and I think you heard it a little bit on the Premier's call, on your last call, was the expression that people are at their peak tolerance, and that imposing more restrictions could actually invite non-compliance. And I wonder, when you're thinking about that, because I'm sure you do, does that factor into your decision making? The fact that there is peak tolerance for a shutdown and for more rules in life?
Omicron doesn't care if we're tired of restrictions. It's going to keep doing what it does anyway. And we have a choice, because we've seen it so many times. If we act early and carefully to hold back, to starve Omicron, right? If we, over the next 2 weeks, don't feed it, don't give it opportunities to spread more than it has to, we'll have a much better winter and a way better spring. We know that. We've been through this before. We're tired of it. But Canadians are now empowered with knowledge. We've shown the highest vaccination rates of so many other countries because people are doing the right thing. We know what to do. So as governments, we can be strongly recommending. We don't have to be enforcing rules to the same high degree where, yes, there is a possible pushback, and rely a lot on what Canadians have shown, which is a thoughtful reasonableness, a willingness to protect our frontline health workers and protect our most vulnerable.
Boosters seem to be key against this variant, but not every province is rolling them out in the same way. I wonder if that worries you, if you think they should be widened out as quickly as possible to all ages.
Provinces will make their decisions. Our job as a federal government is to ensure that there is enough booster supply for all Canadians to get vaccinated as quickly as they possibly can.
Sure, but are you worried that not everyone is going to get it as fast as they should?
We're encouraging everyone to get those boosters as fast as they possibly can.
At the peak, when we were doing our peak vaccine in June and July, it was about 3 million vaccines a week. I know you've got 16 million doses of boosters available. Would our delivery schedule allow us to do as many as 3 million a week if we need it?
Yes. We have enough on hand and enough coming in soon to cover everyone. That's not the limit. The limit is how exhausted our frontline health workers are, how we're able to mobilize people, how people will get their shots into arms.
The vaccine mandate, it was 2 shots in order to get on a plane, a train, work in the public service. This is not really a booster. This is a 3rd dose. Is that where the vaccine mandate is going to end up? Those
decisions will be based on what scientists are saying. The vaccine mandate in the first place was based on the best recommendations of experts. We will keep listening to experts, because that's how we get through this.
Your best, I was talking to Dr. Fauci last week. He thinks it's 3.
If the data indicate that you should change the requirements, it'll be changed. But one thing is certain, that for optimal protection, a boost clearly is indicated.
Is that where you think it's headed?
I think it's probably headed that way, but let's allow time for people to get vaccinated. But yes, get that booster. But I think the principle of making sure that people can get on planes and trains and feel safe, we're going to need boosters.
Obviously, Omicron has restarted that conversation around vaccine equity around the world. And I know we've already given millions of doses to COVAX and to other countries. Is there anything else Canada can do beyond donating vaccines? Can we provide leadership? Can we push other countries to contribute? And what are your thoughts on how urgent that is?
We can and we have been. We were one of the early adopters of COVAX, of the ACT-A accelerator. We're there to push other countries to do that. We're also working with the WTO around intellectual property and ensuring that we can create vaccine production facilities elsewhere around the world. These are things that matter, but it's not just about getting doses to countries around the world. It's about ensuring that they have the systems to get those doses into arms. Canada can and is helping on that as well.
The way provinces have used rapid tests, that's been a big conversation over the past couple of weeks. The way they've rolled out vaccines, the way they've imposed restrictions, it's been very different across the country. I wonder if you've ever wished or hoped that there was a more consistent or differently organized way to approach this pandemic.
You know, there have been a few conversations about that, but we've seen countries that are very unitary in their approach, don't have provinces or states, face real challenges around the pandemic. I like the way Canada works because you get to test different things. I mean, on rapid tests, Nova Scotia has been leading for many, many months on distributing rapid tests, on using rapid tests in a really, really proactive way, and that's been really helpful. We can all learn from what they've done successfully and adapt it to other places. That's what having a more flexible system that responds to the situation in BC being different from the situation in Nunavut.
Yeah, but it also means that the response is uneven and that people are not doing things that they probably should be doing.
What we've been able to do as a federal government is gather together the provinces for like 35 FMMs through this First Minister's meetings to talk about aligning as much as possible while respecting the fact that things are different in Quebec than they are in Manitoba, and they always will be.
Was there ever a moment you thought maybe I should have pulled the trigger on that Emergency Measures Act?
No, because if I thought I needed to, I would have done it. But the reality is a lot of the things that were real challenges would have been challenges for the federal government to do, just as they were challenges for the provinces to do.
Provinces are still asking you for a conversation about healthcare funding. I think it's pretty obvious that the healthcare system is under very deep strain. Any kind of pandemic, any kind of major problem, and you can see how fragile it is. Are you willing to have that conversation soon? And what is actually on the table?
I have said many, many times, yes, let's have a long-term conversation about funding of our healthcare and increasing funding to healthcare after the pandemic, when the pandemic's over. Because during the pandemic, we've been investing billions of dollars in transfers to the provinces, as we just did in the fiscal update. More money for rapid tests, more money for boosters, more money for treatments. We are investing billions to the provinces in right now when it's needed. And yes, we're going to be there for the long term as well.
The Premier's agreed there's urgent, pressing need to act on long-term, sustainable healthcare funding.
Has the pandemic not exposed the province's arguments to show some truth that the healthcare systems are overwrought and strained? There aren't enough doctors and nurses, and you do need to think about some sort of long-term investment.
We do, but right now, we're just focused on getting through this pandemic, and that's why the federal government has been transferring billions upon billions of dollars to the provinces to help right now with clinics like this one, with extra supports, with the vaccines that come in. That's what our focus is now. But yes, this should be a proof point to the provinces that yes, the federal government is absolutely willing to step up on more health care. How much and what it looks like and what is needed, well, those are really important conversations to have.
Just last question. So we've been talking about how sort of fed up everybody is with this, and they want to know when it's over. You obviously can't say that. If you could, you'd be really everyone would want to talk to you.
I'd also probably be wrong.
Well, maybe, yeah. So what conditions do you need to see to know that we are headed towards the end? Like what are you going to watch for to know that we are moving away from pandemic into something else?
I think the numbers of vaccinations around the world is going to be it. Canada has shown that we're going to be able to keep up with boosters, going to keep up with getting vaccinated. How are we making sure we're ending COVID everywhere so it can be over anywhere?
Okay, I'll let you go. Thank you for making the time. Merry Christmas. Happy holidays.
Merry Christmas.
Thank you.
And there's a lot more. You can catch the entire 20-minute interview online at cbcnews.ca or on our CBC News app. Next on The National, the holidays are forcing some families to discuss vaccination status.
Not having healthy conversations about this can lead to very toxic conflict.
So what's the best approach to a sometimes complicated conversation? Plus, what the doctors are doing these days, food for thought as you plan your holidays. Next.
I'm Jamie Poisson, and tomorrow on CBC's daily news podcast, Front Burner, we're talking about the testimony that's come out of the sex trafficking trial of longtime Jeffrey Epstein associate Ghislaine Maxwell. Subscribe wherever you get your podcasts.
Welcome back. For the last week, infectious disease doctors have been stepping forward to provide answers about the Omicron variant. And the questions keep coming in. So tonight, Dr. Alex Wong joins us from Regina, and Dr. Zain Chagla is in Mississauga. And thanks to both of you for joining us. Dr. Wong, we've seen a lot of reports on what's been going on in Ontario and Quebec. Give us the perspective from Saskatchewan.
Thanks, Ian. So the case numbers right now in Saskatchewan are still quite low. Testing rates are not super high at this point. So it's a little bit scary kind of watching what's happening in Ontario and Quebec and realizing that that's going to be us probably in a matter of days, maybe a week, week and a half tops. We know that Omicron is transmitting, in the community at this point. And I think we're the only province, as far as I know, that doesn't have indoor gathering restrictions and capacity limits. So I would really love to be able to see our policymakers take some proactive action this time and help get us ahead of this before it really starts to get out of hand. But we're watching, obviously, Ontario and Quebec very closely, and thoughts and prayers for our colleagues there and our healthcare worker colleagues there.
Dr. Chagla, I'm hearing from so many people on a personal level who are talking about how frustrated, how tired, even angry they feel about this latest twist in the pandemic. What are you seeing from your patients and their families in Hamilton?
Yeah, I mean, number one, access to testing is tough, and people that are trying to do the right thing and get tested aren't able to access it, and often relying on rapid tests and still being unsure. Number two, I think people are realizing now, throughout the pandemic, many people didn't know anyone that tested positive for COVID and are rapidly finding out lots of their friends and family have tested positive. And so many more people being careful, watching their contacts. But unfortunately, people testing positive and us trying to reach them very quickly to offer them therapeutics and get them better.
Let's go to a couple of viewer questions. First of all, this from Emily.
I was wondering how long after exposure would a positive result show on a rapid test? So if I took a test and I showed up negative, does that mean that I'm not contagious in that moment, even if I was to test positive a couple days later?
So, Dr. Wong, that is a very specific hypothetical question. Why don't you give us an answer to that?
Sure. I'll do my best. So, Emily, first of all, it goes without saying that if you have been exposed to someone who is COVID positive, that you need to isolate, and protect yourself, protect other people. From there, it gets a little bit more tricky because the viral loads for Omicron, we know, tend to go up pretty quickly. And so, it's hard to know with certainty exactly when you become someone that's potentially contagious and when your viral loads are high enough to be contagious. If you haven't been exposed and you're just using rapid tests, for example, to try to keep gathering safe and so forth, it's very important for everybody to try to do your rapid test as close to the gathering as you possibly can. Because the viral loads change so quickly, a negative test in the morning may not necessarily mean that you're still negative in the evening. So test as close as you can to the event.
Another viewer question. This is from Kimberly.
My question concerns those of us who are grandparents who babysit young children. We have a 2-year-old granddaughter. We have pretty close contact with her, lots of hugs and kisses and games. And we're wondering, is there anything else that we should be doing to help keep her safe and ourselves safe as well?
Dr. Chagla?
Yeah, I mean, this whole pandemic has been tough on grandparents, right? And they're missing out on a part of their life that's so important. Number one, if you haven't gotten your booster, consider getting your booster because that's going to give you as much individual protection as you can. Number two, there are differences here for example, a grandchild that's in daycare as compared to a grandchild that really stays at home. And the number of contacts that they have. And so when you have more and more contacts, especially as more and more of the world is getting COVID, that creates a riskier situation where you may want to bundle controls like masking or doing the play activities outside or using rapid tests on the child and yourself. So, it really is dependent on the situation. People do need to be careful now as there is an increased risk of exposure. And again, keeping contacts small, getting immunized are probably the biggest things that we can offer.
Literally have 30 seconds from each of you on this last question. We've all been contemplating at least making changes in our life now with Omicron looming. Dr. Wong, first to you. Have you done that?
Yeah, so, schools are closed now here in Saskatchewan, but we are going to keep our kids home from daycare over the next couple of weeks to try to limit contacts and exposures. We're going to keep our bubbles super, super tight just to immediate family, a lot of rapid testing. Everybody's fully vaccinated, and hopefully that'll carry us through the holiday season.
Dr. Chagla?
Yeah, very similar to Alex. The only thing I would add is, we're probably going to be treating many patients as if they have COVID as they come into the hospital, as again, the situation is just so unstable in our community, and so many people have it that it's going to be difficult to sort out who does or doesn't right off the bat.
Well, your patients need you more than ever over the next few weeks, so I wish you both well, and thank you very much for joining us.
Thanks, Ian.
Thanks.
For some of us, making the holidays safer will require some difficult conversations. There's a wide range of views on the risks of the pandemic and the measures that should be taken. Karen Paul shows us the effort to try to bridge that gap.
I'm a main caregiver, can you at least put a mask on then? Damn.
This play is being recorded for a podcast.
I'm not vaccinated. Why? Why not? I don't believe in it.
It's called Dialogues for the Vaccine Hesitant and Those Who Love Them, touching on some emotional topics like misinformation and the mistrust some people have with government-mandated medical procedures.
Hopefully it'll give folks, just a little bit of background and preparation so that they feel they can have those conversations with empathy and compassion.
Almost everyone we asked on the streets of Winnipeg has had a difficult COVID conversation.
How do you convince someone who don't believe in COVID?
This is a free country. Well, it's supposed to be, and you shouldn't have to be forced into it.
These experts in mediation say COVID is an underlying factor in almost every one of their cases these days, whether it's a custody dispute between parents or a nurse threatened at work.
This isn't about trying to convince someone to go to a different position. This is recognizing there are people out there with different positions that are somewhat incompatible, and not having healthy conversations about this can lead to very toxic conflict.
Throughout the training, we will talk about those two different things separately.
So they've created an online, on-demand training course to teach skills like diffusing anger and arguing in a healthy way. And if that doesn't work, how to respectfully end the conversation.
And our job as conflict resolution specialists is to think about the impact of what this virus is and what it's doing to relationships.
They suggest thinking through tough conversations ahead of time. This one from the play isn't going so well.
I don't believe that they work, at least not in the way the doctors say they do.
Okay. Out of curiosity, what medical school did you attend? The University of YouTube?
The hope is that by learning some communication skills, our relationships will survive this pandemic. Karen Pauls, CBC News, Winnipeg.
The University of YouTube, I like that. When we come back, a kiss cam moment on the Jumbotron with extra meaning for one couple.
My hands were shaking, my whole body was shaking.
The moment is next. Jan and Robin Hickey are big hockey fans. They're season ticket holders for the Newfoundland Growlers of the ECHL. They've been to a lot of games. They've seen a lot of couples kiss on the Jumbotron, but never a couple that look like them. That changed, though, recently when their time to smooch on the kiss cam rolled around. Why they found that moment so meaningful is our moment.
We are really, really big hockey fans.
Robin is my first love. Hockey's my second.
For years and years, we go to a lot of hockey games. They took a commercial break, and I was looking up at the Jumbotron, and I saw my red jersey, and I said, Jen, we're on the Jumbotron. A lot of people don't like it. They find it really embarrassing. But for us, I've always wanted to be up there. I'd hold her hand, and I'd say, the kiss cam is on, and she'd whisper, Robin, they're not going to put us on that. My heart would sink because I just thought it wasn't fair that everybody else could get on there and we couldn't. My hands were shaking. I just kept saying to her, we were up there. We were up there. They put us on the kiss cam. They actually did it and put us up there. I can't believe it.
I've been to lots of hockey games out here, and I've often wondered if a same-sex couple would be on the Jumbotron. I've not seen that, so good for the Growlers, good for that couple. And whatever you do, the people that control the camera, don't put me on the Jumbotron. I'm terrified about the possibility they'll do that when the kiss cam comes up, especially because my wife never goes to games. That is The National for December the 19th. Good night.